today your surgery gets over and you are ready to get discharged, and a lot of people ask me, why can't you give a video instruction to be easy for us to understand what to follow after surgery. So before you come from the Sainath hospital where the surgery happened, from there you will be coming to our CPS center, Chennai Plastic Surgery Center, to show us how it is. So as soon as you come to Chennai Plastic Surgery, we remove and show the results. Okay, that is the very happiest part of the whole experience, and you will be extremely happy to see the results, and we are also very happy to see the happiness in your face. Okay, so once we remove the garment and we show the results. After that, we again reapply the garment. After the garment, after we apply the garment, you should not remove the garment for next 2 days. 48 hours, don't remove the garment, because we arrest a lot of bleeding points. The bleeding points, sometimes when there is no compression, it tends to opens up, and if you move, some untoward, unexpected movements, sudden movements, sudden jerks, the bleeding point opens up. That compression is very much necessary to avoid the bleeding and as well as reduce the swelling in that area. So first 48 hours, don't open the garment, whatever it is. If you are going to open, let us know the reason before you open and relax. A lot of people, they complain the garment is tight in the lower half. So because the chest will go inside. For example, they give a medium size, and we remove the chest completely, we remove the chest fat and the gland completely, so it will be flat. But the lower tummy, the upper tummy is bulgier. So what happens is they feel a lot of compression in the upper tummy region. Most of the patients, they complain that pain is not in the chest, because the garment, they feel uncomfortable in the upper tummy, as well as they feel a lot of numbness in this region, as well as some people, they say that a lot of redness appearing here. Everything is normal. Try to avoid it. We are talking with the garment company guys to make we are doing some alterations in the garment. If it happens, probably it won't be a problem. And so when you are going, they remove the IV line. During surgery, they put a IV catheter here, an injection here. So that catheter will be removed before you get discharged. So they put a plaster here with a gauze. So before you go back from the Chennai Plastic Surgery Center, you can remove that and throw it away. Only 3-4 minutes we need to compress it. Maximum, keep it for 20-30 minutes and remove it. What other complaints you might have? Lot of people ask what to eat. Okay, there is no food restrictions, but make sure that you are eating a healthy food. And sometimes if you eat a lot of carbohydrate rich food, what happens is the tummy becomes bigger. If tummy becomes bigger, garment becomes tighter, you feel uncomfortable. So eat a lot of vegetable rich food and easily digestible food, cooked food, so that your stomach won't get upset. And other common questions what they ask is, shall I turn one side and sleep? Usually why we don't want you to turn one side is, if you turn one side, all the swelling goes and settles in the dependent area. So that side looks bigger than the other side, and sometimes it's difficult to manage. But when your sleep is completely disturbed because of lying down flat like this, don't worry. You turn one side and sleep. Okay, because sleep is very important for the healing. If the sleep is getting disturbed, don't worry about it. But as much as possible, try to sleep straight. They'll be given a antibiotic tablet. Usually we give a tablet called Augmentin, and we give up 2 painkillers. It's a tramadol based one painkiller, and it's called Ultracet. Another painkiller is our paracetamol we give in Dolo 650. These 2 are the painkillers, and one stomach protective. Pantacid with the domperidone we give. Basically all these tablets will irritate your stomach, so taking that will help you. So the Pantacid based thing, the Pan D alone you have to take before food, all other tablets after food. They will give a clear instruction in the prescription, so go through it. And all these medications you will be taking for 5 days. And if you take the painkillers in a proper time interval, say example you take the pain medication in the night time, say example around 7-7:30 you want to sleep and you took all the medications, but when you get up late in the morning, say example again morning 7 o'clock when you are planning to take the other medication, almost 12-hour gap, So this medicine has to be taken in 8-hour interval. So you feel a lot of pain in the early morning. So you sequence the tablets and proper time interval so you won't get the pain at all. Sometimes after you taking the pain medication also you feel some kind of a burning sensation or pain in some places. You can keep ice packs. Ice packs can be rolled in a clean cloth and you can keep over that area where it hurts, like over the garment. It definitely helps. You can keep moving the ice pack. Don't keep it for a long time in the same place. Keep moving the ice packs continuously, and that will help to reduce the pain in that area. So other than these antibiotic and painkillers and the stomach protective, few optional medicines are there. Basically the collagen peptide based powders and some skin pigmentation preventing tablets. Okay, these are optional. Usually depending on the grade, I want them to take these optional medications, but it really works. See, this collagen peptide powders and the skin pigmentation preventing tablets has to be taken in grade 1 for 10 days, grade 2 for 20 days, grade 3 for 45 days, and grade 4 for 2 months. Sometimes very severe grade 4, I ask them to take even 10 days prior to the surgery, and after that they have to continue for another 2 months. And these grade 4 cases, sometimes I ask them to take twice a day also the collagen peptide powders if it is very severe. So but it really helps the patient to get the good results, because sometimes patient accidentally having bought the medicine and they come for the review. We will be confused why the results are not good, but when we ask them, they say that I forgot to get that powder, doctor, or like the powder is not available. Sometimes this is a non-vegetarian sources. Some vegetarian people don't want to take this, they end up in a little loose skin. So we have seen these kind of things in a lot of our patients. So we are boldly saying this collagen peptide powders will definitely help you to tighten the skin. So other complaint they normally say is, shall I remove the garment in the night and sleep because I can't breathe, and all those complaints will come. So as much as possible you should not remove it. Very, very unavoidable situation. Remove for few minutes and reapply it. And if you are keeping you are not wearing the garment completely, the whole chest will swollen like anything. Next day wearing will be more difficult. Okay, so you have to continuously wear the garment as much as possible. After 48 hours, we want you to remove the garment and take the picture and send it to us. You can take shower from 48 hours after the surgery. So take the picture after the shower and send the pictures. So in WhatsApp you have to send the picture. So we'll see the pictures. Usually I'll reply you in the evening, but send the pictures. If anything abnormal, we want you to come and show us next day itself. So you have to apply a lot of moisturizing cream over the operated areas as well as in the back of the chest, so that whole area will be it's not dry, so that garment wearing will be easier. Why the moisturizing cream? Usually after the surgery, we'll be going just below the skin, doing liposuction, remove a lot of fat around, gland around. All the sweat glands go for a little lazy mode. It won't work properly. So you won't sweat in that area, so there won't be any lubrication in the chest. Your chest skin become very dry. So you have to apply the moisturizing cream twice or thrice a day according to your skin type. If you are already dry skin person, apply 3-4 times a day. So it helps in maintaining the quality of the skin well, as well as the friction won't be there. It's easy to wear the garment. Sometimes if you are not applying the moisturizing cream, you get a lot of itching. In the very, very unmanageable itching will come if you are not applying the moisturizing cream. So apply at least twice or thrice a day in the chest area. Not necessary for the first 2 days, but after 3rd day onwards. When you are taking shower, that time onwards, you have to use that one. So suture area will be covered with a small plaster, and it is water resistant plaster. From 3rd day onwards, when you are taking shower, you need not remove the plaster. You can take shower with the plaster on. So probably after 3-4 days, the plaster automatically comes out. Don't worry, even over the suture you can put water and clean it nicely. Nothing will happen. Okay, you have to keep the area clean. That is all very important. The water doesn't do any harm when you are cleaning the suture line. So understand that a lot of people advise, your relatives advise, don't put water over that area. Not at all necessary. So you can take nice shower, nothing will happen. water and suture won't do any reactions. And you have to come on 7th day for the suture removal. Meanwhile, during this 1 week, few things can happen. Sometimes one side of the chest suddenly become bulgy, you feel more pain. Sometimes bleeding might happen in one side. You have to immediately report us. In the discharge summary, we will given you 3 numbers, phone numbers. You can contact any of them. Sometimes one person might not pick up. You call all 3 numbers and reach us, so that you have to come immediately to show us how it is. Otherwise, if you have a doubt, you remove the garment, take the picture, and immediately send the pictures to us before you calling us, so we know what it is. So WhatsApp us the pictures. Usually the bleeding is easily managed according to the severity of the bleeding. So it's very rare, but it might happen in few patients. And the pain part, usually patient will easily manage the pain. There is no much complaint about the pain in the post-operative period. But this is the pressure garment what we use after gynecomastia. So this garment, if you see, there will be 3 hooks here. So you see whether this armpit area this properly fits here. Sometimes what happens is it will be so much high so that it like injure the armpit region. So that if it is very much injuring, if it is in the 3rd hook here, you have to loosen by going 1 hook up. Same way, if you not put it very loose also here, because the skin lifting won't be effective if it is very loose. So that make sure that it will be a proper, like properly fits. Sometimes even after properly fits, if you feel it hurting a lot, you have to apply a lot of moisturizing cream there, or sometimes keep some soft cloth in between the garment and the skin. So it helps. Same way, managing the garment. We want you to wear 24/7 without any fail according to your grade, what we advise here. So usually grade 1 and 2, you have to wear it for a month. Grade 3 and 4, at least 2 months. Sometimes we ask you to extend or reduce according to your how you react for the surgery in the post-surgery period. Some people even 20 days I ask you to remove. It depends on how your results are. So you have to send the photograph when you are planning to remove the garment and ask us whether it's okay. If you are here in Chennai, come and show us. We'll see and we'll tell you whether to continue further or we are going to stop it. Same way, how will you manage the garment? See, wearing the garment is like, this has to be outside. This tag has to come outside. When you wear like a coat, first few days you need to have somebody's help by putting like this, and washing this. You should not wash in a washing machine or normally how you wash. You put it in a normal temperature water with a surf or a shampoo in it and dip it for some time and dry it in like room air, putting a fan on so that it dries faster. It takes at least 3 to 4 hours. So ideally alternate day wash it. When you are taking shower, no, you organize everything. First wash the thing, then go for the shower, wait for 1 or 2 hours, then wear it back. Okay, if you feel I don't feel it's hygienic, so buy one more newer one. So sometimes if you feel the garment is loose, we ask you to tighten it in the sides. Okay, the sides you have to tighten it. Sometimes we say 1 inch this side, 1 inch that side. It has to be, that extra thing has to come outside. If you fold and stitch, that will like do a kind of a mark, so it won't be comfortable for you. So make sure that this is outside. When you're sending the pictures, we say better to tighten the garment and all those instructions coming from us. And say the other way to identify garment is proper or not, when you feel comfortable, very much comfortable with the garment, that means the garment is not working. So you have to tighten it some more. Same way, there will be a hooks here. If you see, there will be a hooks here. You have to apply the hooks, then put the zip. It will be easier for you. Post surgery, you see a lot of redness and black discoloration in few people. That is very normal. Don't worry. Sometimes it takes even 2 months to completely disappear, but definitely it disappears. So don't get tense. It is very normal. We do surgery inside in between the muscle and the skin. No. So a lot of the bruising might happen, like how if you fell down somewhere, how the bruises appear, same way it appears in the chest also. That is quite normal. When you need to come back and show us, so grade 1 and 2, you have to remove the garment and send the pictures on 3rd day after the shower, and you have to come back on 7th day for the suture removal. But if you're outstation, you already remove the sutures and you put the glue, send the pictures on 3rd day and 7th day. And after the plaster removal, there will be plaster sticking over the suture line. You remove the plasters and send the pictures also after the plaster comes up. That is adequate. These two great people, after that not necessary to come, but if you are in like in Chennai or some nearby places, you have some other queries, you are welcome anytime. Grade 3 and 4, better to show us on third day. You remove the garment and send the pictures. No, seventh day you have to come for the suture removal. If you are in Chennai and nearby areas, visit us on 15th day and 30th day and end of second month. It will be really help us to like make your results much better. If you are outstation person, send the pictures same way on 15th day, on 30th day and end of 2 months. It helps us to get you more results, because you have to understand, when we remove lot of fat and gland from underlying area, the loose skin will be the issue. So we have to help you to get a good result by giving a small advices. Do massage, tighten the garment, and sometimes we advise you for a radio frequency based machine treatment. All those things we can advise to get you the good results. So keep in touch with us even if you're outstation, and contact us regularly so that we can guide you better. So other common mistakes what people do during the post-operative period is they'll keep the arm stiff like this. So if you're not, we ask you to be very careful. Doesn't mean that you need to keep it very stiff. See, if you're not moving the arms at least slowly, what happens is this muscle becomes very like go for a spasm. It's very difficult to bring back your arm like this after some time. So we'll teach you some simple exercises even from the day 1. What you can do is you can keep the 2 fingers in the adjacent wall so that it will be supported. So you can keep moving your fingers how much are possible, or if you feel that, so say example this level, if you are feeling the pain, just stop it, take a deep breath, wait for a few minutes, again go high like this as much as possible and come down slowly like this. So if you do these exercises regularly, maybe 3 to 4 times a day, the stiffness will be easily relieved. So both the hands, you do it every day at least 3 times. So it relieves us your muscle spasm. The stitch removal. What are the options for the stitch removal? Because we put 3-4 stitches here, 2 stitches here, same way other side. Usually 2 options given to you. One, if you are from outstation person, you want to travel back faster, we want you to come next day, 24 hours or 48 hours later, according to your convenience. We remove the stitches, we put a glue over that area, and we'll send you back home. So you need not go back to say any doctor for the stitch removal, and it will be very safe. Don't worry, we are not doing anything harm. And if you are from Chennai, we also want to see the results after 7 days. So what we say, come after 7 days for the stitch removal. Say example, if you get operated on Wednesday, you have to come next Wednesday. That's called 7 days. Okay, next Wednesday for the suture removal. And usually, like we operate in the morning. You ask our staff what is the ideal time to come and get the stitches removed on 7th day. And what are the other restrictions? Usually the office goers, say example, I have a desk job. When I can go back to the work? Usually 3rd day you can go back to the work. See, but you are a manual worker. You have to lift a lot of weight. At least you have to wait at least a month. Lifting a heavy weights, at least you need to wait for a month. So safer will be 45 days. But the bike driving work, marketing work, you have to wait for 10 days at least. Because 10 days you are not allowed to drive the vehicle. How I go back to the work from 3rd day, you can sit in a cab and you can go to the office and come, that's not a problem. So 10 days no driving the vehicle, 15 days no cardio workout. So after 15 days you can start the cardio workout like running, any kind of cardio workout you can start. Elliptical but better avoid because you involve the chest muscles. So anything involving the heavy weight lifting and all kind of a muscle workout, you can resume after 45 days. So if you are grade 3 and 4, this will be better to start your driving after 15 days, and if you are other cardio workout from 1 month and the muscle workout after 2 months if you are grade 3 and 4. Grade 1 to follow this one, the 10 days driving the vehicle, 15 days no cardio workout, 45 days no muscle workout. Grade 3 and 4, 15 days no bike driving or car driving, and 1 month no cardio workout, and 2 months no muscle workout. This is for grade 3 and 4. Hope you understand this part. What are the issues you might face in the late post-operative period? Sometimes you feel initially it looks very good. After 10 days you feel some swelling under the areolar region, under the nipple region, and sometimes side of the chest becomes very hard. Usually this is because of the swelling only. Massage after 10 days, you can start massaging these bulgy areas or the hard areas nicely. Nothing will happen. Initially it hurts. When you keep massaging, that swelling will disappear slowly. If you start the massage from 10th day onwards, it will be better than waiting for longer time, because when the swelling, when it starts, that time itself start massaging, it disappears faster. Sometimes if it's not disappearing even after a month by massage, we might inject a small steroid injection there. It will make it like swelling comes down. Sometimes the wrinkles forms in the skin area. Basically what happens is the muscle is bare, the skin is also raw underneath. So sometimes one part of the skin goes and attacks with the muscles straight direct, so that what happens, that there forms a groove in the areolar region or a skin region. So what we need to do is, we need to do a nice massage in that region, so that we are releasing the attachment nicely. That can be started after 15 days. We have to press nicely and do a massage like this, then only it will get released. You can do 3 to 4 times a day, 10 minutes. So it will be really helping to get a good shape and avoiding the wrinkle in that area. See, usually the chest will be numb for almost 2 months. Okay, because we cut everything. The nerve has to grow from underneath and it gives innervation to the skin. So it takes almost 2 months for the numbness to become normal. You won't get the same sensation what you had earlier, because that is a glandular sensation like a female breast. Okay, that sensation will disappear, but normal touch and pressure sensation will resume after 2 months only. So be patient, and it will come. See, the first week of surgery you have to be extremely careful, because we arrest the bleeding point during the surgery. When you activate the muscle, when you tighten the muscle so much, what happens is the blood vessels might opens up, so bleeding will happen. If it's a small bleeding, body will absorb it. If it's high quantity of bleeding, we have to take you back to the theatre and we have to arrest the bleeding points. So we have to avoid few things. Any sudden movements, even when you're getting up from the bed, you should not put your full pressure in the hand and rest, and you should not get up that way. What happens when you give full pressure in the hands? This chest muscle will get tightened, some bleeding points will open up. So when you're getting up from the bed, you turn to one side and put your foot first down and slowly try to get up. So only we don't want you to drive the vehicle. Sudden movements will sometimes make the bleeding chances more. And so avoid any faster movements, and as well as tightening the muscle, you have to completely avoid it to avoid the bleeding.